By now, everyone has COVID fatigue, but who's dealing with it more, men or women? And is there a gender gap? The results of a WebMD poll finds women seem to be having the hardest time with this. And joining us with more is Dr. John Whyte. He is with WebMD, and you guys are responsible for this survey. Good morning to you. Thanks for joining me.
Good morning. It's great to be with you today.
Well, I want to get right to the findings of your poll. So we've broken down the information you had sent to us, and it shows 75% of people who were questioned said they feel angry, exhausted, and frustrated with how the pandemic has disrupted their lives. It also shows women more often felt this than men. So tell me more about the specifics you learned, because we were discussing this. Is it just that women are being more honest about this? Or is it really harder on them?
Women do tend to be more honest. And let's just put it out there. We're 2 years in. We're all angry and fatigued and tired. And that's what that 75% talks about, that we're experiencing it at least several days of the week. And as you point out, women are experiencing it more. And what we surmise from that is that women are often the caregivers. They're doing extra duty. So if the kids are at home, they're doing primarily the help with schoolwork. They're the ones that are also typically the caregiver, right? An interesting fact is, if you don't want to be put in a nursing home, have a daughter, because they're the ones that are the caregivers. So much of the burden of the lockdowns, of the mitigation strategies are falling upon women. And that's why they're likely experiencing this fatigue, this frustration, this anger, more so than men.
Okay, now let's look at some of the other results. And the next one, findings that showed that 32% of women said they've been eating more. That's compared to 19% of men. And those who drink alcohol, 16 to 17% of both men and women say they've been drinking more in the pandemic. Talk about that.
Yeah. This is where I'd say men are probably lying, because right, we're all eating more, and we're eating typically late at night because we're also home more and foods around us. It's not typically the case in office settings where we have a kitchen and a pantry, right around us, steps away. And it's those comfort foods. It's the ice cream, it's the chips, it's the popcorn, and other foods that typically aren't good for us. And we know there's a surge in terms of the amount of alcohol that people are drinking. And that's something that we're going to have to look closely at to make sure that people don't start to suffer some consequences from this poor eating and alcohol. Again, as you point out, it's more often women than men that are eating and gaining more weight. But everyone, men and women, are drinking more alcohol than they did, prior to this pandemic.
Yeah. Okay. Finally, more women and people in the under 45 group said that they have less patience, shorter tempers than before this pandemic. As we look at the number breakdown, 26% of women, 18% of men, and less patience, 31% of women, 17% of men.
Yeah. I'll tell you, I'm a little surprised by these numbers, just by that they're not higher, because how many of us really are losing our patience and have a short temper? I think traditionally, men hold it in more, their emotions, and women may be more expressive. And in many ways, that's a good thing. But it just speaks to the fact that this is really having an impact on our mental health, that we're so far in to this pandemic, and we really need some bright lights to start to emerge from this and really preserve our mental health and have resilience.
Okay, Dr. Whyte, one final word after learning about all of this. What would you want our viewers to know about the stress, the anger, the fatigue that we've all been dealing with during this pandemic? What needs to be done to make us better?
We have to acknowledge it's okay to not be okay, and recognize that our mental health and our physical health are very much related. So I'd say to you, control what you can control. Stop watching the daily counts. They're going to go up and down. They're just going to get you frustrated. Do what you can do to preserve your health, which is get vaccinated, get boosted, wear a quality mask, surround yourself by other people that are doing the same thing, and take time to enjoy yourself. That can be hard to do during the pandemic. But you want to find a few minutes a day. Maybe it's reading, maybe it's mindfulness, maybe it's just going for a walk by yourself or with a loved one. You need to start thinking about you right now and preserving your mental health.
I love that. Dr. John Whyte with WebMD. Thanks so much for joining us this morning. Great advice. Appreciate your time.
Always good to see you.
Good to see you as well. Okay, let's talk.